Hey guys, my name's Elicia. I'm a business coach for massage therapists and the owner of Massage Champions. One of the things I want to talk to you today about is Facebook Lives. Now, Facebook Lives don't have to be done on your phone, but Facebook Live is a way of live streaming our knowledge, our information, and our passion through the channel of social media, whether it's through Facebook or Instagram. There are different ways that you can do a Facebook Live. You can do it on your phone through a business page or on your personal page. You can also do it in community groups, and you can do it on your computer or laptop if it's got a camera. Now, the reason why Facebook Lives are such a profoundly powerful way of getting your communication message out is that they are free. The other thing that's great about them is that often we have a lot of assumed knowledge. So we often think that the knowledge that we have around the human body, around how massage or myotherapy or whatever your modality is kind of general knowledge, because for us it is. However, most of the community and most of our clients and potential clients actually have a very limited amount of knowledge of how their body works. And in order for them to be able to understand how their body works, and marketing is a brilliant way to do that, one of the ways that you can do that is actually through the power of Facebook Lives. Now, one of the challenges that we often give to our clients, you might have heard me talk about it before, is a 30-day Facebook Live challenge. The reason that we do this is because most people start their first Facebook Live like this, and they're shaking, and they're scared, and they're nervous. It's a great way to get outside your comfort zone, and it's also an amazing way to connect with your clients. Now, one of the beauties of the Facebook algorithms and all that kind of stuff is that Facebook knows that Facebook Lives are a little bit scary. So what Facebook does is actually notify everybody. If you're going to do it from your business page, it notifies everyone on your business page to say, this person is going live. So it's a way of organically getting yourself out there. It doesn't cost anything to do Facebook Lives. If they're really great and you love them, then you can actually boost that to more people. The other thing you can do with a Facebook Live that's really great is actually share it into community groups. So it's a way for free to get your name and yourself out there so that your community can connect with you even more. A couple of hot tips. When you're doing it, make sure you look at the camera rather than looking at the actual screen. Otherwise, it just looks like you're kind of looking a little bit to the left, like here. So make sure you're looking in the camera. Make sure you hold it up high. You can use a bit of a tilt to make sure that you're talking to the camera rather than your phone. And put some text above the live. So it's kind of like a Facebook post. You can write something before you go live. Give people a reason to click. Often our feed has Facebook Lives through it. Give people a reason to click. So it might be the 3 things everybody needs to know who sits at a desk in order to stop headaches. Or it could be, 5 things that that an office worker could use to stop fatigue. Whatever it is, find something that people can actually go, oh, that sounds like me, or tag their friends because they might find that fascinating or know that that connects with them, and utilize the skills and gifts and talents that you've got. And just, sometimes it can be really helpful to even write it down. Write a list of stuff down, a list of topics. Put down 20 or 30 topics that you could do a Facebook Live on so that you could actually share and connect your passion, your heart, your knowledge with the people around you and into your community so that they can actually have even better health and a greater understanding of what it is that we do.
Hey guys, I hope you can join me next year at National Conference in Adelaide. I've got 2 things that I'm presenting there. A workshop prior to the actual conference on self-care for therapists. Okay, so it doesn't get any more important in terms of therapist well-being. Okay, we're going to pick it apart the whole day. There's so much to address. I'm so super enthused about getting you to work as good and as effective as you can. The second day is peripheral nerve entrapments, and that is all about addressing something that goes under the radar, especially for you as therapists. So we're going to be assessing everyone's tension, and we're going to be looking for your own peripheral nerve entrapments. I can't wait to see you there. I hope you can join me.
Have you completed the Ethics in Practice requirement? Massage and Myotherapy Australia Education Committee, Ethics Committee and Board of Directors introduced a requirement for all association members to complete a module of study around ethical practice. This allows the association to assure the public that its membership holds a strong commitment to professional practice. This free module is reflective and allows therapists to review their understanding of ethical practice. New members are required to complete the module in the first year of membership and again every 3 years. Ethics in Practice module attracts 20 CPE points for members. If you are not a member, you can purchase Ethics in Practice at massagemyotherapy.com.au. For more information or to order the module, please visit the association's website and consider joining Massage and Myotherapy Australia, the home of professional therapists.
Hey folks, Dave Sheen here from Connect. I'm very, very excited to have James Waslaski from Texas here today. Welcome, James.
Thanks, David. It's an honor to be here again.
Yeah, so what are you doing all the way out in Australia at the moment?
So, David, I'm teaching through the WMT. I'm teaching several conferences. One is pretty new. It's on the new nerve release techniques. So I just got done teaching in Brisbane. I'm teaching now in Melbourne. I just finished up yesterday. I'm going to be going off to Perth, which I love, and then going to visit some friends in Sydney.
And you've had quite a few visits out here to Australia. We've had you at the conference a couple of times so far. So it's a bit of an attraction coming out to Australia.
Well, I love it. And the conference, David, is one of the best in the world. I mean, my wife was here, and we've been to a lot of national conferences all over the world. And your conference with this association, with the AAMT, is probably, I'm going to say it's one of my favorite conferences in the world. The friendliness of the people, quality of the education, how they treat their members at the social events in the evenings, at the banquet and stuff. So I can't say enough about how great it is.
We try and make it sort of the flagship event of the year. Yeah, it's been really great having you along a couple of times. Yeah. Now let's just delve back to the past. So you weren't always into massage therapy. You've come from more of a sort of a medical background.
So David, I was pre-med in 1975, so I'm dating myself a little bit. So I was pre-med, I had anatomy, physiology, kinesiology, neurology, some really amazing courses. Then I became a paramedic for almost 20 years. And what was great about that is working in a trauma center and working in an emergency room most of those years got me cross-trained about orthopedics. It got me cross-trained about difference between medical conditions that manifest as orthopedic conditions. So my experience in the medical field really, really launched my career.
Sort of set you up.
It's more than I could.
From a foundation point of view.
Absolutely.
Yeah. And as far as your techniques, I guess you've sort of had a blend of other mentors in the industry over the years, but now obviously you're teaching your own style, and I think you're going to talk in a minute about some new stuff that hasn't really been out here in Australia, but hopefully in the future it will be.
Yep.
But who's sort of been your influences over the years?
I think there were pivotal people. I started in neuromuscular with Paul St. John, because back in the 90s, early 90s, that was the hot trend of neuromuscular was the clinical thing. And then I started to struggle with some of the scoliosis and kyphosis and different things that weren't responding to traditional model of neuromuscular. So I became a personal trainer. Eric Dalton was a huge influence in my life. I've trained with him like 7 times and assisted him several times. Whitney Lowe was instrumental in my life because he taught me the importance of orthopedic assessment, evaluations, clinical reasoning, special tests. Also, Kerry D'Ambrosio was amazing because he took 4-day lymphatic drainage course. I've studied cranial osteopathic techniques. And so the word integrated manual therapy, as you see in my title in orthopedic massage, integrated manual therapy is when you blend maybe 10 or 15 different modalities. So you can choose and pick based on clients' needs. Some people need lymphatic work like with my hip replacement, I needed lymphatic drainage for prehab and rehab. Sometimes I like to just do, for head injuries and concussions, we do the cranial osteopathic techniques, which is really good for that. My daughter had a leg length discrepancy, so I had to learn posturology about true anatomical leg length discrepancies. So that helps me look at leveling the hips and the pelvic base, and it just goes on and on and on and on, and it just gets better every time because now I have all these integrated pieces to the place where I think this is the future of modern medicine, actually.
And it's so good that you just don't sit on your laurels and go, okay, this is what I'm teaching, this is what I taught 5 or 10 years ago, but you're continually trying to find new ways of treatment itself.
Yeah,
and that's really
even
great
what
thing.
we're going to have available to some of your members, David, that we videoed. I spent almost 1,000 hours studying neurology. I wanted to know every bone pressing on nerve, every ligament pressing on nerves. I wanted to know scarring on nerves. I wanted to know why people are misdiagnosed with carpal tunnel, thoracic outlet. So I spent over 1,000 hours. These nerve DVDs that we've got. It was 1,000 hours of studying neurology. I studied with osteopaths, chiropractors, anybody that knew about nerve function of the brain, brainstem, spinal cord. And I'm finding that we're creating miracles in patients that have had nerve pain for 10 and 15 years. It's totally out of the box of traditional medicine, where they'll give you drugs, opiates, they'll give you all kinds of things to sedate you, to calm down your nerves. But they're not treating the core, they're treating the symptoms. So
yeah. Okay, cool. Now, earlier on today, James is doing a couple of online modules for our Halo platform, which is from the Massage Myotherapy Association. So do you want to explain a little bit? Because you mentioned about your daughter, and I think with, who do we have on the table?
I'm so bad with names.
I'm trying to think. But anyway, we had a staff person on the table, and she had leg.
She had a leg length discrepancy.
And you mentioned,
so what we found with her is she just had a rotated ilium.
Yeah.
So when you get a sacral torsion or rotated ilium, it lets you make one leg appear longer.
Yeah.
Where my daughter was actually born with a true hemipelvis, short left leg, and you can't change it. So there's anatomical where you're born with it. And the problem with that, David, is they're always stepping down on that short leg. And so the pelvis is tilting, the discs are bulging, the ascending kyphosis and scoliosis is happening. And unless we get the hips and legs level, we can't treat the upper spine and neck. So I learned a lot about difficult case studies teach me to, okay, I got to step it up. I got to go another level. I've got to find the answer.
Yeah. So we did 2 different modules today. One was to do with the lower extremity, and then the other one was cervical, cervical, depending on which part of the world you come from, is how you say it. But we talked about the neck.
Yeah, so when we got into the neck, what drove me to do this is a nurse friend of mine. Her husband built our home, and she went to one doctor, and they said had carpal tunnel. The other one said thoracic outlet. The other one said, no, it's due to your whiplash. And she was so frustrated because none of them, they were relying too much on nerve conductivity tests, but they were false positives. Like if they would do these tests for the nerves of the wrist, they would light up. So I went through and researching, okay, brain, brainstem, spinal cord, dural tube, cranial osteopathic, cranial sacral, getting the central nervous system functional. But what I found is if we don't do all the tests of clavicular, ribs, scalenes, pec minor, and clear all that, then anything you test in the arm is false positive. So they're expecting, the carpal tunnel patient's expecting you to work the foremost and hand, and it's never going to work because it starts in the brain and the nerve roots here, the nerve roots under the clavicle ribs. So we're doing more like osteopathic work where we're getting the bones to move properly. So the new thing, David, is I want you to know, is the pain coming from joints that are too stuck or too hypermobile? Is it coming from ligaments that are referring because ligaments are under stretch? Is it coming from nerves that are entrapped? Is it coming from muscles that are injured? And so through good assessment, we sort out joint function, disc function, nerve function, ligament function, and muscle tendon strain function. And sadly, many massage therapists, as I travel the world, focus too much on just the muscles. And many chiropractors that I teach, I just taught 220 chiropractors, right? They focus too much on joints. So if we don't balance out the musculoskeletal relationships of nerve dysfunction, then we're just treating symptoms. So it's been a journey of over 1,000 hours of study. But again, I'm over 60 now, so I have to be able to raise my A game and consistently do that.
Yeah, yeah. And are we expecting to see you out here maybe next year?
I would love to, David. I like I said, your conference is one of the best in the world. I've got at least 2 new courses that I've never taught in Australia, and I've been coming here since 1996.
Sure. Yeah.
I taught at the Olympic Training Center in 1998, and I just actually love the people of Australia. You know, your friendship is dear to my family, my wife, all of us. The association members have treated me like a family member. So it is one of my favorite countries to actually teach and learn from people. You know, I've learned stuff from you with what you teach, and I think that's what I want to do. I want to keep integrating with industry leaders, so in the future, as we blend all of what we teach, we can change the face of modern medicine. That's my goal in my middle age now.
Fantastic. Well, how do we find out a little bit more about what you do? And your resources and
Yeah,
I guess
David,
via a website?
we have a website. I have a full-time staff, and our website is www.orthomassage.net. And you'll see that we do chiropractic conferences, physical therapy conference, osteopathic conferences in Europe. We do a lot of, my vision is to integrate what all healthcare providers and manual therapists do for the best interest of the patient. So if you go to our website, you can get literature, pathologies, videos, DVDs, course information. And again, it's just www.orthomassage.net.
All right, fantastic. You got that website, folks. Once again, James, it's been great having you over here.
Thanks, David.
And hopefully we'll see you again next year.
Awesome. I'm looking forward to it. Thanks a lot.
And you guys, thanks for tuning in. We'll see you next time.
Joining Massage and Myotherapy Australia is easy. Visit the Massage and Myotherapy Australia website, www.massagemyotherapy.com.au. Click Join Now, where you can either join online or download an application form. Your qualification will define which level you join: massage, remedial, or advanced member. Ensure you provide all information requested, including certified copies of your academic transcript, qualification certificate, and statutory declaration. It's important you certify documents and complete the statutory declaration. Documents can be certified by members of certain professions, such as medical practitioners and pharmacists. Also ensure you provide clinic details, first aid certificate, and insurance certificate of currency. If you choose our preferred insurer Aon, you'll be eligible to receive a discount. Once your membership is processed, contact Aon directly via the Massage and Myotherapy Australia website. Once the association receives all required information, your application will be processed. Join now and choose the Association of Professional Therapists.